Hello everybody, welcome back to Let's Talk About Sleep, the channel where we talk about sleep. Here's the book, Let's Talk About Sleep. Just as I always say, these videos are for educational purposes only. If you have any medical decision making that needs to be done, whether a new treatment or switching over, you always got to talk to your provider, okay? But hopefully these videos give you the impetus and the information to do so. If you like this video, please click like, please subscribe to the channel, please share this with your friends and family, and ask questions in the comment section below. I will answer them at some point if they're appropriate with a video or either right back to you, okay? So thank you for watching. By the way, speaking of subscriptions, at 1,000 subscribers, I'm gonna send a random person a signed copy of my book. So look forward to that as we get there. Okay, so what we're going to talk about today, we're going to keep going forward with this sleep apnea series, as it were. And just to reiterate from my other videos, you'll know is sleep apnea are stoppages, obstructive sleep apnea, are stoppages of breathing that happen when the airway back here behind the tongue closes down. Okay, so when we're awake, our airway looks like this back here. We fall asleep, the muscles relax, airway gets a little bit smaller. Over here, when the airway's a little tight, that's what snoring is, right? As the tissues vibrate. And then when it's closed off, that's sleep apnea, okay? So, as we know from previous videos, Cpap is the best thing, right? Pressurized air comes in, goes all the way down to the back of the throat, forces the airway open. But for a variety of reasons, not everybody can tolerate that, or not everybody wants that. Fortunately, we have something else, the dental device. That's the second line down. Mandibular advancement device. Now, what is that? What this is a mouth guard, and I happen to have one here, made by a dentist, okay? And what they do is they mold it to the upper and lower teeth, like a sports mouth guard, okay? Now, you see these brackets here. What this is doing, it's pulling the lower jaw forward. So the lower jaw is the mandible. By pulling it forward a couple of millimeters, what you're doing, you're taking the tongue, the base of the tongue, away from the back of the throat. Again, opening up that airspace. All it takes is a few millimeters to keep that airspace open. All right. Now, are these as effective as Cpap? No. Cpap is really like I said, the gold standard. But what I always say is, if the Cpap is sitting in the machine, sitting in the closet collecting dust, and this is not as good, but it's used every night, this is probably better. Okay. Now, I usually reserve these for more mild to moderate cases, okay? I have used them in cases where somebody has severe sleep apnea. I have had success in severe sleep apnea, but usually these are more mild to moderate type things. Now, for a high-quality one like this, that's made and custom-made to the person by a respected and reputable dentist, these can be anywhere from $500 to $3,500. Okay, either paid in installments or at one shot. When a patient comes to me, I have a list of people that I will refer to get this kind of work done. Okay, they sell ones you can get online. Snore Rx is one of those, and basically what that is, you send away to the company, and they send you a boil and bite device. So that's kind of soft plastic. You put it in boiling water, and then you kind of take an impression of it yourself, and it molds to your teeth. That usually I would reserve for snoring, or if somebody has like maybe borderline sleep apnea and they just want to try something out, I would maybe have them do that. But for real significant sleep apnea, you really want to go with one of these, okay? Now, these do have problems, right? One is that can cause jaw discomfort. You know, you're doing this for 8 hours or whatever it is, there can be some TMJ discomfort. Some people can feel like their teeth are moving, although it's not really shown to be the case, especially if the dentist, is knowledgeable in doing these devices. But the biggest thing is you really can't monitor how somebody is doing at home with one of these the way you can with Cpap. What's great is these Cpap machines these days, they actually record how the person is doing. So I can see, okay, Mr. Jones has been using his Cpap 8 hours a night. That apnea number, that apnea index that we worry about, that has gone down from 60 times an hour, right? 60 stoppages of breathing per hour down to 0.1, right? That's hard and fast proof that it's working, okay? With the oral devices, we really don't have that. Okay, we can't really measure how somebody's doing on a night-to-night basis. What we'll do is we'll have the device made, and then we'll retest the person, either with a home test or an in-lab test, to make sure that it's effective. Now, once that's done and the person has had their test and either they had it further adjusted or it's good where it is, then we'll say, all right, just make sure you're using this every night, and probably in 5 years or so these should be replaced. That's usually the kind of standard approach. Okay, but like I said, if it's between this and nothing, this is definitely an option to go. Insurances usually won't pay for this. Medicare sometimes will if the person hasn't tried CPAP already. So unfortunately, patients are put in this position where they're not even sure what they're going to try yet. Should I try CPAP? Should I try the oral device? I'm not sure yet. Unfortunately, Medicare only lets them choose one or the other. So in those cases, I usually do, like I said, recommend CPAP. But this is a good alternative. Okay? So the mandibular advancement device, the oral device, the dental device for sleep apnea, that's what this is. And this is just one kind, by the way. Okay? So that's the video for today. Like I said, please click like, please subscribe. 1,000 subscribers, signed book. And until next time, sleep well.